So today I will be sharing with you of how irritable bowel syndrome is seen with the functional medicine perspective. So the key objective of today's talk is to look at the key functions of the gut, the digestion, the intestinal permeability or the lining of the gut, the intestinal microflora or the microbiome, and how immune system around the gut can play a role in the gut function, and of course the gut feelings, which is the nervous system. And how do we treat these problems is the 5 R's. We remove what is causing problem, we replace the missing digestive enzymes, we re-inoculate the good bacteria, and then we help the gut repair itself, and then we help the nervous system balance with some exercises. So the problem, what's happening with IBS in today's world is that we are stopping the inquiry when we reach a diagnosis. So when somebody comes with diarrhea, pain abdomen, or constipation, pain abdomen, we'll try to evaluate, do a colonoscope, do some histopathology examination, do stool test if required. And then if we don't find anything positive, if we can't see anything positive in the gut, we conclude that it is irritable bowel syndrome. But the problem is, once we make a diagnosis, we should start asking how did the patient end up with that problem. So that is why that's the new perspective with which we have to look at IBS. So we have ICD codes, which is the diagnosis code. And the insurance companies want us to categorize disease based on ICD code. So that is why IBS is part of the ICD code. And just because we're naming it with a disease, we get confused and we think we know the cause also. But this ICD code is not telling us anything about the cause. So all these things it comes under the functional somatic syndromes. So how do we look at IBS now? So you see, according to the ICD code, a functional somatic syndrome is a cluster of symptoms which has no adequate medical explanation. And this can include chronic fatigue syndrome, irritable bowel syndrome, multiple chemical sensitivities, myalgias, and metabolic syndrome, and all these things come under the same functional somatic syndrome. And a lot of people, because they don't get answers from doctors, they don't even, they just manage the symptoms by themselves. And definitely these problems are much higher in women compared to men. And it is more when patients will start experiencing these symptoms before they turn to the age of 35 usually. And then it sometimes increases with age. So coming to the allopathic or the gastroenterology diagnosis, there is a criteria for IBS classification. It's called Rome 4 criteria. So this criteria is recurrent abdominal pain on an average or at least 1 day in a week in at least 3 months, associated with 2 or more of these following symptoms. Related to defecation, it could be inadequate defecation, increased defecation, decreased defecation. It can be associated with change in frequency of stools and change in the form of stools. So like you see, the criteria is only symptomatic. There's nothing to understand the cause. And this is the treatment chart in the conventional gastroenterology. If patient has pain, we give antispasmodic and sometimes antidepressant. Nowadays, most of the time, we give antidepressant for people who have pain. If it's constipation, we give a laxative and a fiber. And if there is diarrhea, we give a antidiarrheal drug. So everywhere, although probiotics will definitely play a role if it is used properly, because we have not been clear about how to use probiotics in these complex conditions, it's always a question mark of whether to prescribe a probiotic or not. And if there is any alarming features, then we go on testing. We do blood tests, endoscopy, colon imaging, colonoscopy, stool for occult blood, hydrogen blood test, and antibody for certain chronic diseases. So, like you've seen, all that we are doing is suppressing the symptoms. So, how do we find the underlying physiological imbalance? So, in when you look at the function of the gut, you can divide it into 5 things: the digestion and absorption. The lining of the gut is responsible for the intestinal permeability. On the lining of the gut, you have another layer, which is the microbiome layer, which also plays a role in your gut function and digestion. And then we have the immune system, which is 70% of the immune system is around the intestinal circulation. So any trigger from the gut, the immune system is triggered, and there is inflammation because of the trigger of immune system. And nervous system. So you all must have heard of second brain, that the nervous system around the intestine is so complex that it can be like a separate brain by itself. And the signals which the abdomen is sending to the brain is more than the signals the brain is sending to the abdomen. So I'd like to share with you all 3 cases which typically will, most of the time will be categorized as IBS and then be given symptomatic treatment. So a 32-year-old male who has returned from traveling to the rural area had occasional abdominal discomfort before traveling, but now he comes with 2 to 4 times stools since then. So initially he would have gone to a doctor and he would have prescribed antibiotics. But even after antibiotics, he's having stools 2 to 4 times a day. So for the past 3 months, because of the dysbiosis, which has not been fully corrected, he doesn't get cured fully. And that constant dysbiosis, or the imbalance between the good and the bad bacteria, will further cause more immune disturbance, and that may end up with permanent change to the lining of the gut also. So what I did for that patient is to give, I felt, because they're treated with antibiotics, it's usually a low-grade parasite infection also. Sometimes parasite infections don't get picked up in stool test, stool microscopy or stool culture. So that is why we have to treat with antiparasites. Many times we can treat them with 1 or 2 tablets and see how they respond. If there is good response, then continue the full treatment. And we can also use oregano oil and replace the enzymes, because most of the time when there is a lot of dysbiosis for an extended period of time, for a few weeks or months, always there is negative feedback to the enzymes, and the enzymes will be suppressed. And then we re-inoculate the good bacteria. The probiotics has in tablet form. And since he didn't have any other symptoms of myalgia, pains, fatigue, or he didn't have any mucus in stools and all these other symptoms which show that there could be leaky gut or increased intestinal permeability, I didn't give any nutraceutical for the leaky gut. And of course, the rebalancing of the vagus nerve should always be there. Stress reduction, increased sleep, and like how Dr. Ria did a breathing session in the beginning, we always recommend pranayama and breathing exercises. So within a few days, the symptoms completely resolved, and when the patient came back after 6 weeks, they say it's completely fine and absolutely no problem. And it's been 1 year and still the symptoms has not recurred. So these Entamoeba histolytica especially can happen when you travel, you eat outside food and you end up with diarrhea. It usually doesn't respond with just 5 days of antibiotic. and we may have to give more antiparasites. But the same condition can be mistaken as IBS many times. The next patient is a 24-year-old female with intermittent recurrent abdominal pain and discomfort since 5 years. So every time she's under stress, the pain abdomen increases, the abdominal symptoms increases. So every time she goes to a gastroenterologist, she's given antidepressants. And she's also given antispasmodics and antidepressants. So she feels better when she has just taken the medicines, but then again, within few days, she's back to all the symptoms. So when I look at her history a little more deeply, she complained of food not completely getting digested. She still had some undigested food in the stools, and the stools were not fully formed. Sometimes she had light colored stools. That means the pancreatic enzyme is not functioning well. And foul smelling stools also can show that the fats are not properly digested. So the pancreatic enzymes are not properly able to function. And then we can also do a lactulose and mannitol test. We give the patient lactulose and mannitol to drink and then do a breath test. That I get it done sometimes, but not always, because it's unless it's a proper gastro diagnostic center or a tertiary care hospital with the gastro as the prominent branch, they don't have this facility. And this showed that the breath test was positive. Now that shows that there is decreased absorption and increased permeability in the gut. And then the gut microbiota, stool microbiome test many times comes out normal, or there will not be anything to do with respect to the microbiome. So in this lady, it was almost normal. There was nothing alarming in the microbiome test. And if this patient was from US, so there is a little advanced microbiome test. So it's called the GMAP test. So that also shows some immune cells like IgA in the stools can be measured. And we can also look at blood immune cells like TTG, which shows celiac disease. And we can also look at endomysial IgA, which also signifies celiac disease. So she always had a lot of bread and pizzas and pastas, but the symptoms were not very severe that anybody suspected that she could have these positive, and no evaluation was done. So I removed the offending food, which is the gluten, put her on an elimination diet because these two tests were positive, and then gave her digestive enzymes, hydrochloric acid, and pancreatic enzymes, and then started giving her probiotics to reinoculate the good bacteria. And because she had other signs of leaky gut, I gave her L-glutamine. And with that, I usually give aloe vera and slippery elm and zinc carnosine. And also made her use a device to measure the heart rate variability. So people who are very analytical and don't believe in meditation and breathing exercises, a very good thing to do is to give them biofeedback device, which they can just fit it to their ear or use it as a watch. So that measures the heart rate and also calculates the heart rate variability. So that will customize the breathing exercise based on their heart rate variability. And that also gives a feedback of whether they're relaxed state or they're in a sympathetic dominant state. So in the next 6 weeks, she's significantly improved, and in 12 weeks, she almost had nothing, no symptoms which she had previously. Third patient is a 43-year-old patient of GERD, the acid reflux disease, since 3 years, and she's always been on PPI. That is an antacid, usually a Pantocid or a Veloz or rabeprazole, those kind of strong tablets. and she also has IBS since 2 years. So when I looked at her history in detail, her digestion and absorption didn't have a problem. Her stools were normal. She didn't have any constipation or diarrhea. Her intestinal permeability were not there. Like, she didn't have any body pains and she didn't have a lot of bloating and all that. There's just moderate alteration in bacteria. There was no fungal overgrowth, no parasite, no pathogenic bacteria. And immune system also, there was nothing significant. So what happens when a person initially comes with gastritis? It can be a mild gastritis, or it could be a H. pylori infection. H. pylori infection, unless we do an endoscopy, we cannot diagnose. And many times these patients are put on a PPI forever, because that's very easy to control the symptoms, and even doctors don't have time to spend in a clinic. It's within 10 minutes, if we have to assess something and give a diagnosis and give a prescription, we tend to do what is easy for us. So they put on antacids and PPIs, and that keeps worsening the digestive system, because that's completely suppressing the digestive system. So first thing I did was started tapering the PPI, started giving her digestive enzymes with beta-NCL, then giving her a lot of probiotics, and also started giving her a prokinetic. Iberogast is available in the US. It is a very good prokinetic. In India, there are a lot of equivalents, which is a combination of licorice and ginger, can be used. So that can stimulate the gut and reduce the reflux. And although for this particular patient did want rebalancing, she said she'll do the breathing exercises by herself. I have noticed that most of the patients with GRD or NERD, that is non-esophageal reflux disease, these patients, endoscopy will be normal, but still they experience reflux and these symptoms. So these patients also benefit a lot when we work on the vagus nerve. The vagus exercises, breathing exercises, relaxation techniques help a lot. So if you can see, if you look at the functional aspects of the gut, and all of them are given the diagnosis as IBS, but when you'll see the functions, or different kinds of functions were affected in different patients. And if you look at the treatment based on what functions are affected, we can also give different treatment to different patients. So that is why there is no single IBS, if you say. So we have to understand the relationship between the digestion, intestinal gut lining, the microbiome, the immune system, and the nervous system. So based on this relationship and what is going wrong, we have to personalize the treatment for every person. So that is why when we say all disease begin in the gut, we are really just starting to understand the gut. And I'm sure in the next few years, we'll understand a lot more about the gut and the gut microbiome and the vagus nerve. And the treatments also will become much better in the coming years. So with this, I would like to end the session.